Wow, what a beautiful question. I mean, it's always a joy to give a message to women, particularly women who work in the health science space, because I think our forte is nurturing and caring and saving lives. And so my message to the women of the Faculty of Health Sciences is to say, first of all, that the work that you do matters, and we really appreciate the work that you are doing. But most importantly is to say to the women a very strange message: please self-care, because most of the work that we are doing, we're caring for for everybody. We're taking care of our homes, we're taking care of our families, we're taking care of our patients. And I think in this Women's Month, do something different and take care of yourself, nurture yourself, and really recognize that you too are worthy of being taken care of. For me, being somebody who's broken glass ceilings and sat in spaces which have been, historical in their milestones, I have ensured and made sure that I bring up the young people especially, and also other women as well. But in tandem with that, I have not left the men behind, so that they also have an understanding and in terms of supporting the women who are in these spaces, whether it's leadership spaces or spaces which may be academic or whichever service spaces as well. And so my one message then, I think, is always make sure that you replicate yourself. I want to categorize the women into three categories. These, first of all, the women who I may not know personally, and women who I haven't met, but really who've charted the path. And then there are women who are, in my circle, in my professional circle, who've really just done amazing things. And so if you look at the women of the past, they really sacrificed for me to even remotely have a voice, or even for me to be sitting in this kind of space. And then the women in my professional circle, they really are my sisterhood. They are the people who, in their various spaces, it may not be in medicine, it may be in accounting, it may be in law, it may be in engineering. They are the people that you can have a conversation with. They are the people who, in their own right, they are really making their mark as women. And then I have women in my own personal life. If I look at the women in my family, I come from a family of very bold, tenacious, strong women. And so that is the blood that runs through me. It's been, to be honest, so humbling, because I came to this faculty as a young 17-year-old from a small town. At that time it was called Queenstown, now it's called Gomani. And it's a full circle moment to walk the same passages that I walked as a young 17-year-old medical student, and now to walk the same passages as the dean. I want to say to the young people of the faculty, both the women and the men, is to say to them, let this be a testament to say that whatever you are thinking of doing, you too can make history. And so think bigger, think bolder, and also always recognize that your success has been enabled by not only just you and maybe even your family, but it's a collective endeavor of an entire population and community. My advice as the first woman dean is to say, as we are looking forward in terms of driving and advancing the women agenda, we also shouldn't leave the men behind, because I do know, for instance, for myself, many of my mentors who have enabled me to sit in this position and make these historical milestones have been men. And so for the men in our lives is to say, your sisters, your mothers, your daughters, your cousin, they really can make, and also shape these particular environments. And so please support them. And for me, an incredible incredible honor to be the first female dean of this faculty.